Okay, welcome back to Cusp of Coffee. My name is Uwais Adam, a fourth-year dental student.
And I'm Dr. Klerk, a somewhat tired community service dentist.
A government slave.
Yeah, I wanted to chat a little bit in this episode about like the day-to-day happenings of a ComServe dentist, because I realized in one of the previous episodes, I kind of talked about being a dentist as a whole, as sort of a macro view, but I wanted to take a little bit more of a micro view and just do a little bit of almost like a little bit of a week in the life of just explaining like, okay, what does reality look like as a ComServe dentist? So just for reference, I'm currently employed with a district post with Department of Health, which means I don't have one specific clinic I work at. I have a bunch of different clinics that I go to. From what I figured out from my friends, it seems like around about 40% of us end up with district posts, and the rest all end up with like a specific clinic where it's like you work full time at a certain hospital or clinic. But for me, I work at a district post, so my weeks are usually very, very varied based on where I'm working. So I'm going to use this past week as like a bit of an example, just to give people an idea. So on Monday, I was working in Welcome Free State, little clinic there, right in town, which is quite nice, because there's a mall literally like 2 blocks down the road. So it feels very like, you're in civilization and there's things to do and not
Urban, yeah.
Yeah. So, and it's what I've noticed, the clinics that are a little bit more urban tend to have more facilities as well. So it's one of the only clinics where I can actually do restorations. So it's not just extractions the whole time. I can do restos as well, which is usually quite a nice bonus. But in true dentistry fashion, my patients didn't pitch for their resto appointments. So on Monday, I was just an extraction machine. And then on Tuesday, so usually on Tuesdays and Thursdays, we do outreach. Yeah. So on Tuesday, I went to a place called Brandfort, which is one of our outreach clinics. And it's actually very close to Bloemfontein. But because of how the districts are divided, it's part of our district. So it's like just over an hour drive to get there. Yeah. And then you see all your patients. Luckily, I will say, government clinics in general, at least in our district, pretty well organized. Like you get there, you'll have a list of all the patients you have to see. Everyone's like ready to go. They're already standing in line. So usually once you get there, things move pretty quickly, which is definitely nice, because that was something that I was a bit hesitant about going into ComServe, where it's like, am I going to be a dentist or am I going to be like an administrator as well? But luckily I can just most of my energy can just go into the clinical side of things, which is nice. That's ideally what you want in a system like this. So yeah, outreach, we usually have like a set number of people that were booked for the day. We see everyone and then we drive all the way back. So outreach days like Tuesdays, you usually get home pretty late, but you're not necessarily working the whole day. It's just there's a lot of travel time and stuff that you have to factor in. So the work on outreach isn't that bad. It's just it takes up your day because of all the traveling. And then Wednesday was busy. A lot of the times Wednesdays are like my hospital days. So we have a district hospital and we also have a regional hospital here. And usually on Wednesdays, I'm at either one of the two. And what I've noticed at the district hospital, that's usually one of the busiest places I work at. I think, I'm trying to remember, I think last Wednesday we ended at like 42 or 43 patients. So it's just like a lot of people coming through, and it's a mix of stuff. It's extractions, it's consults, it's SMPs, it's restorations. So bit of a more varied scope on
Yeah.
those days, which can be good or bad because like one extraction is obviously way quicker and way easier than like one resto. So yeah, days at the hospital can sometimes also get pretty long. I think the latest I've been there was 6 p.m., which is like a few months
Yeah.
ago.
But
That day I was
otherwise, what?
pretty tired.
But like besides those days, what time do you usually finish on that Wednesdays?
I mean, usually, so how it works is we are there until 4. But obviously, you'll have days where people just aren't coming to the clinic necessarily. Or perhaps you just, you sort of hit one of those flow state days where you're just
Yeah.
working really well and everything just works and the cases are straightforward and stuff. So then you'll finish before and then you just kind of wait around to see if there's anyone else that's coming or what. So that's
Oh,
usually how the routine goes.
so you left at 6 that day because there was just overflow,
Just
like way too many
yeah,
patients. Yeah.
yeah, too many people. And yeah, because like we got to like 4 and it's like, well, technically the day is done. But when you just have that many people,
Yeah.
I don't know, I just felt too bad to send
Yeah, you
anyone
don't.
home.
Yeah, you don't want to turn people away.
And it's different, I think, because it's a government institution. It's like, well, people don't necessarily come here because they want to. It's just like this is their clinic, like they have to come here.
They have to. Yeah.
And there's not really alternatives. So I'm like, okay, you know what? They came, they waited. Let's just push and see if we can finish.
Yeah. Yeah.
So yeah, but Wednesdays, very up and down experience usually, and then Thursdays once again on outreach. There's this one outreach I go to a lot on Thursdays. It's not that far away. It's like 30 minutes ish. It's usually not that busy either. The only thing about the clinic that gets me is like dental is somewhat separated from the rest of the clinic. So the majority of the clinic is sort of like, it's like a proper clinic and it's like a brick building and everything. And then the dental clinic is kind of like a storage container on the side in the field.
Oh no.
Which is like, which to be honest is what I had in my mind going into ComServe,
Yeah.
So, but yeah, that's definitely whenever I'm working at that outreach, that's the most rural experience I get because it's like, wow, I'm in a container in a field.
Pulling
Doesn't
teeth
get
out.
yeah, doesn't get more ComServe than that. And then yeah, Fridays are just wherever. So because we're multiple dentists in the district, essentially whenever someone takes leave, everyone else needs to cover for that person. And lately we've just been having a lot of people going on leave. So pretty much every Friday for the past few weeks, I've been working somewhere else to basically cover someone else's shift. So yes, every now and then I'll have like an outreach on a Friday, or I'll end up back at one of the hospitals, or just essentially wherever there's like a gap that needs filled. The clinical manager will usually send one of the ComServes there, because it's just easier to move the ComServes around compared to the permanent dentists. So that's usually how that goes. But yeah, for the most part, I mean, like 99% of the time, I'm doing extractions. And then every now and then, based on where I'm at, like if I'm at the hospitals are all equipped to do surgical extractions as well, which is quite nice.
Oh, nice, yeah.
Because yeah, if something breaks, for example, on outreach, then you need to refer back to the hospital, which is always a bit of a pain. But when you're already at the hospital, it's like, okay, well, I broke this crown, but it's fine. Let me just like do a surgical extraction quickly. So
So do you get told like on the day besides the usual, because the gist of your schedule, like Wednesdays here, Thursdays there, but like on the Friday, do they just tell you the day before or on the day, or how does the schedule just change like that?
we usually do it every week. So over the weekend, you'll get your schedule for the next week. But
Oh, okay,
I
okay.
find that often, like, you'll wake up on a Wednesday morning and then, you know, it's like, oh, the schedule has changed because someone is sick or whatever.
Oh, okay, okay, okay. So it's
So
quite
it's,
flexible. Like they just you have to be ready to
yeah,
just adapt.
yeah, basically, it's one of those systems that it works because everyone in the system is willing to work, which I think is good. I think, especially like in
Mm.
a government system, that's what you need. You need
Yeah.
people with a work ethic because, yeah, things are going to move around and it's not always going to be ideal. So I think if you like go into ComServe, and it's always funny hearing, because obviously like our supervisors and stuff, every year they get a new batch of ComServes. So, you know, I am but a number to them. But it's always funny hearing like their stories of like just terrible ComServes and people that were just like, where it's almost like it would have been easier if they stayed at home every day. But
Yo.
yeah, like the common thread I've seen among like difficult ComServes is just people that aren't willing to be flexible. And it just makes it extremely difficult for everyone else. So, yeah, pro tip for anyone going into ComServe, just keep an open mind. Of course, it's going to be uncomfortable. Of course, it's not going to be the same as university. That's kind of
Yeah.
the point. So just, yeah, just keep an open mind going into it. Um, Something that's quite entertaining is that with the outreaches and stuff, we don't use our own cars because it's like extremely far sometimes.
Oh, okay.
So we get like government cars that we can use, so that we
Oh,
don't have to
damn.
pay for like the petrol and stuff. But it is a bit of like a roulette in terms of what they'll give you. So at the start of the year, they were giving me this like a kind of old Nissan Almera with like a big dent in the front. And I don't know, there was something about the car that just looked sad. It looked like a very sad car. I think
Sad on the
it was just
inside.
it's just the headlights were kind of drooping a little bit, so it looked like just depressed eyes. And I felt so bad for this car, but at the same time, I didn't like it, so I kind of bullied it. Um, so yeah, Nissan Almera, very sad car
Sad.
that I drove around with. Nothing against Nissan Almeras in general. It's just the very specific one they gave me just looked like it went through some stuff.
Previous owner was not a good person.
Yeah, and then like a month or two ago,
Yeah.
they started giving me this like ancient Isuzu Baki. And this thing, like, I think in like the Mesolithic era, this thing was roaming around because, it
Government
has
got an
seen
arsenal of old cars.
it has seen some better days, and it's been in like a few major crashes to the point where the left
Oh
door
no.
doesn't open. It's like permanently dented in. um, so, and that thing, like, as soon as you get close to like 120 kilometers, it falls apart. So it
You got a
it made
call.
all the outreaches so much slower because you'd have to drive in this thing, and it wasn't a like comfortable ride. So yeah,
Oh no.
I appreciate them giving me a car for transport, but yeah, that specific bucky really tested my patience and my own gratitude in life.
So, so do you just like rock up to work and then you get the car and you go to outreach and then bring it back and leave it there?
Oh no, okay, okay, it's not that streamlined. It's not. This is
So,
still this is still the public sector.
so how does
So
it work?
so we have a transport office that we go to, and then we have paperwork that we have to fill in and stuff, and then you can get the car, and then you can go on outreach, and when you come back, there's more paperwork to do.
Oh, lovely. Always.
But yeah, as much as I'm joking, it's actually quite streamlined. It's pretty quick. It takes like I want to say like 15 minutes to get the car. So
So have you ever just been like, I'll just take my own car this time?
no, because it's like an hour drive. So it's like I'm not gonna.
Oh.
No one's gonna pay for that petrol.
True, true,
Or if
true.
something happens on the way, like, because Free State roads are pretty bad.
Mm.
Um, so it's like if anything happens, I'm liable for that. So it's like
Oh,
I'll rather just take the government car because they have seen a lot, they have
mm.
survived a lot, and they will keep surviving. So I'll rather just take the government car.
Yeah, let the
Um,
government worry.
but I have to say, like 2 weeks ago, they started giving me like a new Volkswagen Polo.
Oh,
And
damn.
when I tell you, going from that oldie Suzuki to a Volkswagen Polo, you could have literally, a Rolls Royce could have pulled up next to me, and I would have felt like I was in higher luxury than the Rolls Royce. Like, yo, I climbed into that thing, and like all the seats were there, and it had
All the seats were
Bluetooth,
there.
and I was
The
just
bare
like,
minimum.
dude, I'm living the life right now. So, the past
I've
two
never
weeks
heard
I've
someone
been,
say, I've never heard someone say, I got into the car and oh my word, guess what? All the seats were there. Wow. Like that is just amazing.
yeah, no, I think the government Volkswagen Polo, I think, is the best car that money can buy in 2024. That's my official opinion.
official, official stamped here on the podcast. 20 minutes in, government polo, best car ever.
Yeah. So yeah, government keeps you busy, but I'm enjoying it. I'm enjoying it a lot. It seems like a lot of my friends also having a lot of fun in
Mm,
ComServe. So yeah,
yeah.
I don't know. I was quite nervous going into ComServe, but especially now, like 6 months into it, I'm just like having the time of my life. You get really used to the way government works and how everything is structured and stuff. So yeah,
Yeah. It's,
it's a fun time. But yeah, lately I've slowly been thinking about life after ComServe.
mm,
Um, so there's like a few dentists in town, so I've been like going around and just shadowing a little bit, just to like get my brain back into it.
yeah.
Just like watching a root canal being done and be like, oh yeah, I forgot about this, I forgot about that. It's like it's funny how quickly you start forgetting things from university.
Yeah.
Um, but yeah, so slowly trying to fix my brain again on private. Then again, I don't think anything can necessarily prepare you for private. I think both you and
Mm,
I have experienced this because I mean, even when I was a student, I shadowed at practices, and I know you've been shadowing at practices for a while.
mm.
And I know that now that you're on break, you've also been doing a little bit of shadowing. So I wanted to get your opinion a little bit on your thoughts around private practice dentistry and like university dentistry and some of the key differences that you see, especially now that you're sort of in it. I think
Yeah.
it's more apparent for you to see like the contrasting factors.
Yeah. I think like like you said about getting used to the whole government system, it's kind of like how you had to get used to the campus system at first. But unlike the campus system where you start and it's the only thing you kind of know, because that's the first experience you have, when you go into, whether it's like ComServe or going into private afterwards, you're coming from something, so you have something to compare it to. So a lot of students, I realized, that don't shadow or don't know what private practice is like, they don't have anything to compare it to. So like you and I, because we spend a lot of time in practices, even in university, we kind of know that this, what we're doing in campus, in clinic, isn't the final form of what we're going to be doing for the rest of our lives. And
Mm.
a lot of people don't actually know that. So they don't have things to compare it to. And I think that can actually be a blessing and a curse at the same time. Obviously, it has its downside or the negative factors about it, because you don't know what's to come and you don't know how to prepare yourself. And you kind of think that everything is about what campus teaches you. You think that for the rest of your life, you're going to be doing BPE, BOP, probing on every tooth, taking a full mouth of x-rays, things that just aren't realistic in the real world based on time and money. But so that's the negative side, is that you're not prepared. But the positive side, I realized, is that you also are less, like, you're less comparing, like, you're not comparing as much, because there's a lot of times where I get frustrated at campus because we have to follow a certain procedure that I know for a fact doesn't exist when I leave. You know what I mean? Like, it's like, why do I have to do this in this way? When I qualify, I'm not going to have to do it again. Um, and so I kind of broke it down into like my thoughts into three different factors if you look at private dentistry versus university dentistry. So the three factors are basically comfort, management, and money. So
Okay.
comfort is basically the fact that I think from what I've observed, private dentistry is way more comfortable for the clinician than it is in university. And because in private you have your own assistant, you have your own equipment, and equipment that you bought, that you've tested, you know that it works. You have whatever materials you want to have there. You have your own X-ray unit, and you also have like that instant gratification. Like if a patient comes in and they need something, if I have the time, I'll just do it immediately. Whereas at university, it's just not like that. There's no assistant. You're working on your own. It's not your own equipment. Every week you sign out equipment and you get something that you don't know what you're going to get. Like you open up and there's something's missing or something's bent or something's broken or there's no materials available or they just ran out of this and they don't have this shade, etc., etc. X-ray units, there's nothing. Like you have to go use the one, like with one or two at UWC, couple of X-ray units, and everyone has to wait for it, so that extends your treatment time.
Yeah.
Nothing is easy to access, so the comfort factor I think is a lot higher in private, and that kind of lends itself to point two, which is basically management, like being the boss. Because when you're in private, a lot, if you watch those dentists, they don't worry about the mundane things. Like they don't worry about booking patients and setting up their station or cleaning up afterwards, or like anything like that. They don't worry about even mixing materials. Everything is just ready for them because they pay an assistant to do that. So they basically, because of the comfort and that management factor, they can just focus on the dentistry, which is what we all essentially signed up for. And they basically then can focus on what matters, because a lot of the procedures are difficult as is, but when you add all these other things that you have to think about on top of that, like booking your patient and setting up beforehand, and like leaving late because you're still cleaning up, or rushing because your supervisor's like wanting to leave and you going overtime, or things like that, waiting to take a x-ray, worrying if your GP is going to move in the canal because you have to take your patient and walk somewhere to take an x-ray, all these things. Like there's so many different examples, but if you don't have to worry about that, you can purely put all of your energy into just making sure the dentistry itself is good. And you can't do that at university. And the last thing is money. And like, what else do I have to say there? You don't get paid at university. We pay to do the work. So in private, you're like literally slave away at campus and you get paid nothing. And you get to private and you do the same amount of work and you get paid for it. Whether you're getting paid X or Z, whatever it is, like you're still getting paid for your time. And so it's a lot more sort of, you have a little bit more motivation to do the work. But at the same time, even if you don't worry about the motivation factor, it's like that reward factor is there, that tangible reward factor, because you're like, okay, at campus, the only way you get rewarded really is by getting a quota or getting your supervisor to really tell you, okay, you did a good job. And your patient satisfaction, that's it. Whereas in private, there's no one watching over your shoulder, but you still get that patient satisfaction, and everything else is made up for by money. And I mean, who doesn't want money? So those are really the big things that I've noticed when I shadow at practices and I compare. And I have to say, I would say to anybody who's listening who hasn't shadowed, just do it. Because watching people do the things you're doing, but obviously watching them do it with experienced hands, you understand what they're doing and you see things that they're doing. You're learning without even speaking. And also it lets you look forward to what's to come. Because when I watch them work, I just feel like, oh my word, I actually can't wait for this to be my life. Like it just looks so comfortable for me. And I already love the dentistry. So having my own practice or my own room or my own assistant and my own way of doing things, it's just like it gives you a lot to look forward to, because you realize that the troubles you have at campus won't necessarily be your biggest issues in the future.
Yeah, it's like certain issues aren't necessarily dentistry issues. They were just dental school issues.
Yeah,
Yeah,
100%.
on that note of like comfort and money, I have this very clear image from when I was a matric, and I went to this one dentist close to where I grew up. I had an appointment with him, and I remember rocking up, and his car was standing outside. It was a pitch black Porsche Cayenne, and I walk in, and the front desk lady like does all the admin of me. I walk in, he's in his chair. I sit down. We do the treatment, and I ask him a little bit about his life, because at
Yeah.
that point I knew that I had gotten in for dentistry, and I was going to be first year the year after. And then he told me, and he was quite old at that point. He had been working for decades, and he told me that he had basically gotten to a point where he had eliminated everything that he doesn't like doing. And he says to the point now where everything is flows so well at his practice, where he arrives in the morning, sits in his dental chair, and then he doesn't leave the chair for the whole day, because his team just does everything else that needs doing. So he can
Yeah.
literally just stay in his chair and do dentistry, which is what he wants to do. And yeah, all the auxiliary stuff he just outsourced to the rest of his team. And I was like, that's a pretty interesting way of kind of, I guess, like gaining control over your own environment and just customizing it into something that you really enjoy and that you're getting compensated for.
Yeah.
So yeah, I don't think I'll ever get to a point where I don't think I'd want to do that. I think it's good to get out of your chair and just stretch a bit. But,
Definitely health wise.
but yeah, just seeing like that level of control over his day to day was really interesting.
Yeah.
And that's definitely something I'm sort of looking forward to in private, where it's like, as I go along, I can start customizing it and sort of tweaking little things.
Yeah.
Until I get to a point where it's just like it's sort of optimized for me,
Yeah.
As much as you're still, doing healthcare and you're seeing people, you're doing it in a way that's extremely sustainable for yourself, because
Exactly.
you've made every aspect of it. You've made the good parts better, and the bad parts you've either made good or you've just gotten rid of them. And I think
Yeah.
that's really interesting, because in government you don't have that. When I look at like the permanent dentists I work with, very cool people, they're very happy with their jobs, but there is an element of stuff that's outside of your control. Like if you don't have a certain material, it's not a matter of, oh, I'll just order this. It's like, oh, now I need to get through 10 layers of admin so that the
Yeah.
government can give us a grant to get these materials again. So I think it's just that control factor, I think, is one of the main things that's really dissuading me from government. Because I think I have to say, I find working in government extremely meaningful, because I feel like my day-to-day work, the average, I guess, how can I put it, like the sort of impact factor per patient, I feel like is much higher when you work in the government versus when you work in private. Like if I have to compare, going to like a very rural community where once a week we go there and that's the only dental care that's available, taking away those people's pain and getting rid of those infections, like that means a lot to them because they don't have a different choice. That to me means a little bit more than like, I don't know, replacing a composite because the patient doesn't like the shade all that much,
Yeah.
So yeah, I think there's a lot of pros and cons to working in private versus working in government or working in academic. But I think the biggest thing is just trying to figure out like what's the level of control that would make you happiest. And I realized for me, like I definitely crave being able to have a lot of control in my life, being able to set my own hours and what I want to do and what I don't want to do. So I think most likely I will still end up in private, as much as I enjoy working in the government and as much as I respect people that work in academic. For myself, I think I'm probably going to end up in private, and I
Yeah.
think you're going to end up in a similar place, because I think you'll also enjoy working in government, but just knowing you like having
Yeah.
control over your time and what you can do
Yeah.
and what you can't do.
Yeah, I think a lot of what you said applies to me as well. We're very similar in that sense, but also because besides the control factor of like having to like optimize things, make it sustainable, you have that freedom to optimize for fun, like we always try to do. I mean, both of us, like whether it's university, whether it's this podcast, whether it's anything, like we're always trying to optimize for fun and gamify things. And you can do that if you have your own practice or if you're working in private, because you have that control to, like, maybe I want to give each patient a free toothbrush, or maybe I want to have a games night with my staff every month, or I don't know, like whatever. I'm just spitballing, but you can just do whatever you want, really. And that's the fun part. And I think there is room to combine those things, because government versus university versus private, like you said, there's pros and cons, but there's a way to combine both, I think. And that's the difficult part, finding that sweet spot. But if you I think I'm looking forward to ComServe a lot. I'm looking forward to the challenge. I'm looking forward to that, just that feeling you get from just helping people, because it's free services, and like you said, they don't have access to other things. But ultimately, if I do want to end up in private, you can still do things like that and get that same feeling. You can do an outreach. There's outreaches happening all the time. You can do free work on the weekends. You can give up a day of your week. Like you have that opportunity to control what you get and what you do with your skill that you have. And I think that's what's nice about dentistry, is because the thing is, we study for 5 years and all those knowledge is literally sitting in our hands and our heads. And so we can go wherever we want, or to a certain extent, and control how we use that. So whether that's fully in government and maybe you don't really care about diversifying the treatments and the procedures you do and you just want to help people, then maybe government's the best fit. Maybe if you want to do more higher end dentistry, then maybe higher end private is what you want to do. But you can still do aspects of both. It's not like you have to pick one, you know? So that's what I think is nice, the option of that.
Yeah, I like that. I like that approach of it. Yeah, I think it's always interesting for me looking at, for example, watching like day in the life vlogs and stuff, or listening to podcasts from dentists from other countries.
Yeah.
Because something like what you said earlier, like it's very difficult to compare when you don't have a point of comparison.
Yeah.
And so I realized stuff like ComServe doesn't exist in a country like Switzerland or Norway.
Yeah.
Because their whole socioeconomic structure is different. And so for
Even
them,
outreach doesn't exist.
yeah, and so even for them, like their idea of like high-end dentistry, even the idea of standard dentistry is different from ours, because what people want and what people need are very different. A colleague of mine, he knows a dentist in Norway. And what's interesting, in Norway, it's kind of mandatory every 6 months to go to a dentist. Because, yeah, in a lot of like the Eastern European countries, you get taxed like crazy, like 50%. But then like the government also gives you a lot in return. And so, for example, like the government will pay for most of the dentistry that happens. And what's interesting about that dentist, for example, is he says 90% of the time he's doing checkups and SMPs.
Damn.
And I found that really interesting, because part of me was like, oh, that sounds so, yes, so nice, so like easy and comfortable and stuff. And then I was thinking about it. Yeah, I was thinking about it a little bit more, and I was like, okay, but what if I did that for like 10 years? And
Yeah.
I was like, at some point, I'd probably just stop showing up to work because I'd rather be doing almost anything else.
Yeah.
So yeah, I think that aspect of it is pretty interesting. Like the purpose aspect of the job, I think is pretty interesting. And I think I'm just scared. That's one thing about private that I'm a little bit hesitant about. But I mean, I think the way you put it is, you put it very well in that, if you feel like the work isn't that purposeful, you can find ways of making it purposeful again.
Yeah.
You can go serve a community, or you can offer up a day where treatments are free, or just do something, to just like give you that feeling back if you ever get to a point where it just feels like you're not necessarily contributing in the way that you feel like you want to be. So yeah, that's a good point. I haven't necessarily thought about it like that, so I'm adding that to my little mental
Yeah.
library.
I think like with the control that you get over your staff and your team and optimizing your workflow, you get control over how you use your skill as well. Especially when you're not like the struggling dentist and you're a bit more established and you can afford a lot more things. I mean, it's like it's so niche, this aspect, but I look forward to this a lot. But the fact that you graduate as a doctor and you have skills and the means to do things that a lot of, like, I mean, majority of the population just can't do, people become reliant on you, your patients, your community. And so, but from that aspect, your family as well, because an aspect that I really look forward to actually doing one day is just being that person that, like, somebody has a toothache, whether it's your in your household, whether it's your cousin or your wife or your child or your wife's brother's child, whatever. They're like, oh my word, Johan's a dentist. Let's take him there. They bring the person to you, and boom, you fix their problem. And you fix it easily because half the time it's a simple filling or something. And then they're like, oh my word, thank you so much. There's that gratitude coming out, and you get that boost, that positive boost of energy towards you. And then
Yeah.
you're like, it's okay, it's on the house, it's fine. Like, don't worry, don't pay. Your money is foreign here. And these people are like, what? Oh my word, thank you so much. Like, that specific aspect of just being able to help people that I know, maybe, or just being able to decide, you know what, I can see this person is struggling. It's one filling. I can afford it. It's okay. Don't worry. Don't pay. Like,
Yeah.
small things like that. You have the power and the control to be able to do that. And that's not even speaking about the large scale things, like where you can do someone's whole treatment for free if you want, or you can maybe even talk to the lab and say, hey, listen, this person is really struggling. How about, what would you say if we cut the cost by 50% and I'll cut my cost by 50%? The lab makes them the denture, and like, you facilitated that. And then even bigger, if you go for outreach and you just do free work the whole day, just because you can, and it's nothing except your time because you have the skill already. So you have a lot of control in that sense. And then you can also scratch other itches, like you can go to courses, you can do the high-end dentistry, you can do the dentistry that costs a lot of money, you can make a lot of money. Like, it just doesn't have to be confined to one thing. You can diversify, and that's something I really look forward to a lot when it comes to this profession specifically. And I think it's very different because they always say, like, oh, if you do dentistry over medicine or something else, you kind of have control over your time because I decide when I open, when I close, how many patients I book, etc. But you also have control over the type of work you do
Yeah.
and what you charge for it and how you actually do the work. So yeah, it's something to look forward to.
Yeah. Yeah, I was having a discussion the other day with Prof. Foster, which we did an episode with him. For anyone who hasn't listened to it yet, I think it's
Yeah,
one of
check
the
it out.
best episodes we ever did. So definitely
Definitely.
check that out. But yeah, I was in Cape Town the other day, and then we went out for dinner. I was talking to him, and then I was just asking about like his routine now, because he was in academic dentistry for the past 9 years, and now he's gone
Yeah.
back into private, but almost exclusively just does endo, because he's like a wizard when it comes to endodontics.
The Merlin
And
magician of endo, yeah.
yeah, and then he was telling me that, for him, he gets like the most gratification out of doing an extremely difficult endo case, like something that on average, maybe another dentist would really struggle with, and he gets sort of a kick out of being the one to sort of master a difficult case. And then he said he had this one day where he was looking at like some of his colleagues' like schedules for the day, and he saw like consult, follow up, like a chipped 1-1 that needed a resto, consult, and he was like, "Oh, that looks so nice." And he said, he had a day where he asked like the front desk to book him just sort of like routine patients for like routine work. And he said after that day, like he just kind of felt bored, and he was like, yes, it's easy and you still get paid, but it's not what I want to be doing. And now he's just back to doing his endos with his big microscope and everything, and he's having a blast. And it's like, yes, he goes and he does hard work and he has to concentrate the whole day, and not every day is going to be great, but as long as it feels purposeful, like that gives you the drive to keep going. And it's just interesting for me to see how that picture looks different for everybody. And I think that's part of why dental school dentistry can cause a lot of like burnt out feelings, or even like I've heard like the first 2 years of private can kind of feel like that, where you don't have that control. It's like, you need to do this many crowns and there's nothing you can do about it. You have to do those crowns, Or it's like you have to see this prosto patient today, or you have to do this endo today, and you don't have a choice, like either it happens today or it happens next week, but like you have to do it at some point if you want to get the quota to move on. And I think the moment you go from, oh, I want to do this, to I have to do this, then I think everything becomes a heavy lift. Even the smallest task is like, do I have to do this?
No, definitely. And that's also very personality dependent. Like some people just don't mind doing quote unquote what they're told, like, okay, this is what the timetable says, I must just do it, like, oh well. And then you get other people that are like, I'll love to do this, but if you tell me I must, I'm going to hate it. Like, don't make it my choice, And like there's certain things I just, like, do I mind the scale and polish? No. Do I inherently hate it? No. But do I like complain and moan about it every single time I have to do it? Yes. Like I look like the most upset, depressed person during my pedio sessions, because I'm doing a scale and polish, and I tell everyone every time, like, I'm never touching a hand scaler when I leave this place ever again. Like, no, I'm not doing this. And it's because I have to do it, and because they insist that you must do it in this specific way. And just, again, it's that aspect of comparing it to the outside world and looking at what a cleaning looks like outside to what it does inside. And you're like, oh my word, I can't be asked to do this. So that's where that the comparison can be a curse. But also something to look forward to, because like I'm not sitting there thinking this is going to be my life. I'm just going to do scale and polish the rest of my life. Like, no, I know there's more out there. I can decide one day to employ a hygienist and just never touch a Gracie curette again, which is the plan. That's the plan.
Yeah, your now is not your forever. I remember in final year, I was getting extremely grumpy, like the day before a test, mainly because I had been writing tests for like over half a decade, and I was like, why am I still writing tests? Like I was just so over that recurring process of content, sit down, study content, write about said content, move on to the next subject, Like I had gotten to a point where I was like, listen, I know how to do tests, so why are you still testing me? And I would just get like sort of in a foul mood before every test. And someone sent me this meme one evening of like when you choose an academically challenging degree and you get academically challenged. And I was like, listen here, don't at me like this.
It's not my fault.
Yeah. So Yeah, but it was one of those things where like you kind of just have to suck up and do it because
Yeah.
even in just like 12 months time, it's probably irrelevant, you know? Like
Mm.
studying for, I don't know, public oral health is now takes up 0% of my time, which is great.
Yeah.
But to get to this point, I had to be in a space where, oh, I'm going to sacrifice my entire Friday evening to study the Ottawa Charter and, you know, the pillars of healthcare and all
Oh,
that stuff.
the fact that I know what that is a problem. Like, why do I have to know? Like, it's taking up valuable space in my brain. I don't have space for these things.
Yeah. And yeah, what I
Yeah.
find interesting now, now that I'm studying for boards, because now I'm like a month and a half out pretty much of writing board exams. And
Mm.
like some days, like I mentioned in the previous episode, it's really difficult to get myself to sit and study.
Yeah.
But that's primarily on the days where it kind of feels like I have to do this thing of like, oh, I wrote it on my to-do list, therefore I have to do the thing.
Yeah.
But I gotta say, like, I've been finding it easier to study on weekends because it's kind of like I'll sit here and there's not a lot going on in town, so there's not a lot to do, and then I'm kind of like, actually, let me sit and study. And the moment it kind of becomes this thing of like, oh, I actually want to do this,
It
then like the
becomes easier.
motivation
Yeah.
is very high, and it's nice to kind of have that relationship with studying again where it's not constantly, because I remember like in final year every single test just felt like this massive, I have to do this, I don't have a choice. But at least with the board exams, in part it's kind of like, technically speaking, I don't have to do this, but I want to do this. And so
Yeah.
yeah, overall motivation levels for studying this year is much higher than it was last year. Also, I have a fun update. I literally got this last night at like midnight. In a previous episode, I spoke about how before you write the American board exams, you have to get something known as an ECE report. And I had been like struggling a little bit through this administrative process of just getting this report done. And I finally received my report yesterday. And when I ordered my report, you have the option of paying a little bit more, and they will work out what your American GPA is. And that determines at which dental schools you can do a bridging course and at which ones you can't. So I got all of that last night. So first up, according to the report, I did in fact study at a dental school. So
Oh, okay, okay. At
yes,
least we got that out of the way.
yeah, we got that sorted. I was really worried about that, you know, that I was
University of
being
Pretoria, it
just
actually
scamming
exists.
people.
Yeah, it wasn't only in Johan's head the last 6 years of dental school. It existed. Okay,
Yeah.
we know this.
Yeah, I wasn't just tripping for like 6 years. I
Tripping on
actually,
acid.
I actually went there and I learned
Okay,
stuff.
cool.
So first part sorted, and then second part, I got my GPA, which is 3.5, which was way higher than I expected.
Damn.
And it puts me in a really interesting position now where I am eligible for every single dental school in the US. Like there's not a single one that I can't apply to, which I'm really thankful for, because I was imagining the worst case scenario, and I was looking at like dental schools that have the lowest requirements and stuff. And I was like, okay, I'm either going to end up in one of two places. I'm either going to end up in Texas or I'm going to end up in Alaska. And that's about it. So I'm extremely thankful that they sort of recognized the, how can I say, like the work from South Africa, and that they were like, oh, actually, like this matches a lot of our standards, and that helped to kind of push up my GPA.
So basically,
yeah,
like a 3.5 is like equivalent to like a high 80, 90 score, isn't it?
yeah, I have no idea
Something
what
like that.
what the percentage is, because I mean America measures everything in like bullets per bald eagle. So I don't really know what the numerical value is.
Very accurate.
But yeah, that was a big relief, because I'm not gonna lie, especially when I was a student, And I would sort of talk about my plans for the US and stuff. Everyone was always extremely negative. And they were kind of, yeah, just kind of talking about how, like, SA is not recognized anyway, and like all this kind of stuff. And it really made me feel as though I was at a severe disadvantage. But something that only clicked for me somewhat recently is that 100% of the people I've spoken to about going overseas and working abroad have never worked abroad. And so it makes sense that the data I was getting was skewed very negative, because you're getting the people that either never tried or they tried and they failed. That's the sample group. And I've never gotten any responses from the group that actually succeeded and are now living somewhere else. And so, yeah, it's just little stuff like that that make me realize that, like, okay, maybe this whole thing is possible. And that's part of why I'm trying to, just kind of cover my own process of struggling through this. Because, if I do succeed, then it's like, okay, suddenly there's a roadmap for like how a South African dentist could work overseas, where maybe previously there wasn't really, because it's like difficult to get info on it. So I definitely want to keep like just every now and then when something happens regarding this process, just like update it on the podcast, just to like give an idea of like, just kind of realistically what this would look like if someone is like trying to go through the same process. And my big message for this week is just don't feel hopeless about it. Because especially when I got my GPA, I was like, this is so much higher than I expected. And academically, I wasn't like insane. Like I wasn't even in the top 10 of my class, and still my GPA was fine. So definitely don't give up before you've even tried.
So you would say that our degree is in our country is quite recognized overseas.
Yeah, it's obviously just not a thing of like, oh, you go there and suddenly you can work immediately. But the actual content that is covered, it seems like is actually at a very high level and is very relevant to the stuff that they do as well.
Yeah.
So that's a good sign. That's a positive sign, as it means you won't get there and then it's like you're in the deep end.
Did they do like
no
a full,
idea
what did they just convert your marks from your final transcript, or did they do like a comparison of what you did compared to theirs?
According to their website, cool. They did a comparison. I'm not gonna lie. If I was the person working there, best believe I was just opening up a calculator and just going, there's your GPA. But according to them, they look at like comparing
that's
factors.
Good. That's
and
promising.
Stuff. So but overall that was. But I guess all that matters for me now is just the result, which I was happy with. So next step is just actually getting there, not dying, and passing the exam. So that'll be the next two big updates. So if you don't hear from me again,
and we're just never going to mention this again. It's like, oh, what you
never.
Board exams? What are you talking about? We never covered that. Delete episodes. Nah, but I'm sure it'll go well. I feel like you're on the right track with all of this, and the bases, like your research is sound and your bases are covered. So like this is a lot further than you've ever come, and it's a lot more real than it ever was. So that's like a very, very good sign and like really good progress.
Yeah, it's actually a good point. Even as you're saying that, it just clicked in my brain that even if I didn't pass, I could just write it again and it would be easier the second time. For one, because the admin would already be in place. So I wouldn't have to get the report and everything again because I already have it. And also,
you know what to expect.
Then I would have written the test once already. So I know what it's like. Yeah, because at the moment I'm a bit like hesitant because it's like, okay, I'm going to fly all the way to New York. It's going to take 2 days to get there.
Yeah.
And then I'm going to be super jet lagged. and then a few days after that, that I'm writing this massive exam for 2 days. So in my head, it feels like this gargantuan task, and it's like, I don't really know how this is gonna play out. But after I've done it, even if I don't get the result I
Yeah.
want, it's still like, oh, well, at least now I know. It's like, oh, actually, I should have booked off one extra day just to sleep more, or use this day to do revision, or like whatever. But at the moment, it's kind of a thing of like, I don't know what I don't know, and I don't know anyone who knows what I want to know. So it's like I literally have to just kind of go in blind and kind of figure it out. And yeah, I'm hoping that by sharing it on the pod, I'm making someone else's journey in a few years maybe a little bit easier, or at least just shining some light on like the stuff you need to do. Because I remember when I was looking at this stuff, I didn't even know what an ECE report was. I didn't even know it was a requirement. So it's like, it's stuff like that that hopefully,
Yeah, no,
hopefully
definitely.
will
Because
help
even when
people
I
out
looked into stuff
along
of
the
like
way.
moving, there's just there's just no, there's no video, there's no like report or like forum, or like it's just very little information out there from South Africans specifically in our context moving to other countries. And so like any information that we add to it is more than what there was before. And so it's just clearing up that massive question mark that's just hovering over this idea of moving. So, yeah.
Yeah. But yeah, okay, I think that's a good place to
Yep.
end this week's episode. The next episode, the next one or the one after that, we'll see how it goes, will be pretty interesting. We have a dentist turned lawyer turned lawyer of dentists coming on the podcast to just help clarify some stuff, to tell his own story. He's a pretty entertaining dude.
Yeah, definitely going to be one
But
to look
yeah,
forward
we
to.
shall get to that in one of the next episodes. But for now, thank you for joining us for another
Enjoy the
episode,
week ahead.
and we'll see you in the next one.